Mr. Wurzel, is it?
Yeah.
Hello,
Yeah,
Dr.
yeah.
Galloway, I'm one of
How
the
do you
ward
do,
doctors.
Yeah.
Right, pleased to meet you. So, I've come to have a chat to you about some treatment you're going to be starting.
Yeah. Well, for the TB, yeah.
That's right.
So what would it be? Antibiotics or something?
That's right, yes.
Oh,
So
good.
What have you
Should
been
clear it.
told so far about the treatment? Have you?
Well, they've said it's to do with TB or something, and it'll be antibiotics, which hopefully should clear it pretty quickly. So
Right, okay.
I'll be able to get out of this place if you can sort a prescription out for me or something. Because I've certainly had enough of this place, I can tell you.
Right.
This little tiny room here, it's
Yeah.
gosh. 6 days I've been here. 6 days, without a drink.
Okay.
Oh dear.
Right. Well, there's a few things I need to go through with you.
Okay.
A bit about the treatment.
Yeah.
About the sort of the plans in terms of where we go from here.
Yeah.
So do you know what TB is? So it's an infection.
It's just an infection,
Yeah,
so
okay.
antibiotics should clear it up from,
Well,
because they're very good these days, aren't they, the
they
antibiotics?
Although there's a but to this. So TB is a difficult organism, a difficult bug to treat,
Yeah.
actually. It's an organism that doesn't tend to cause the straightforward chest infection.
No.
You've had symptoms for quite a long time, haven't you?
Oh, the bronchitis stuff, yeah, bronchitis. Yes, I've had
Yeah.
that quite a long time. Yeah.
TB is a very slow growing bug.
Mm.
So, unlike people who get a straightforward pneumonia where they get ill over 2 or 3 days,
Yeah.
people with TB often get ill over many months.
Right, okay.
Had you been losing weight or getting
I
sweat?
think so, yeah. I mean, I've not weighed, but I think, I think I've
Yeah.
been losing weight,
Well, in terms of the treatment,
Yeah.
the treatment often takes many months as well. Well, not often, always.
Yeah.
We need really to have people on the antibiotics for 6 months.
Gosh, 6 months as long as that. Well,
Yeah.
I suppose, it'll have to be, really, won't it? I mean, it won't stop me having a drink, will it, though?
Well, how much do you drink a day?
Well, I mean, I suppose... well, I mean, cider I normally have, because that doesn't cost too much, I can't afford too much. I like vodka whiskey if I can get my hands on it, but it depends what anybody's managed to get.
How much,
we sort of
how much
share this
cider do
stuff.
you drink a day?
Oh dear. Well, a few bottles, I mean...
What size bottles do
Well,
you
the
drink?
litre ones, because it works out cheaper from the,
Right, okay.
the supermarkets and things. And
How many bottles would you get through in a day?
4, 6... It depends, 'cause
Okay, so
obviously,
quite a
when
lot.
they've got the money, yeah. Well, but what else is there, really?
And how long would a bottle of whiskey or vodka last you?
Well, again, it depends. I mean, normally, if depends who I'm with. Obviously can't do anything at the Salvation Army, the Sally Ann. But if I'm with any of my mates, and one of us has got a bit of money or so, and we've got a bottle of whiskey or a vodka, then we'll share it out. Because it's what you do. So
Right.
if I'm lucky, there's just a couple of us, maybe half a bottle then.
Okay.
Yeah.
I think there's a couple of things that are going to be an issue with your treatment.
Mm.
So let me tell you a bit more about the treatment. So treatment for TB means we need to have you on treatment for a long time. I said 6 months.
Right, okay.
Initially, that means giving you 4 drugs, 4 tablets on a regular basis. We can actually give them as a combination, so it doesn't mean you take 4 different tablets.
So all in one.
But
Okay.
we give you combination tablets, but we have you on 4 different types of drug to treat the TB.
Yes.
And we normally keep people on those 4 drugs for the first couple of months. And during that time, the lab where we do all the tests on the TB will give us more information about the bug, your particular strain. And then usually after a couple of months we can go down to a smaller dose, to just giving 2 of the drugs.
You mean there's different sorts of TB?
Yeah,
There's different
there's
sorts.
different types of TB. And then we give 2 drugs for the final sort of 4 months of the treatment.
Right.
There are some issues about these drugs. these drugs have potential for causing side effects, though. And this is something I need to talk to you about.
Yeah.
I'll give you some written information about these drugs, but I'll tell you the important side effects now. One of the drugs can very rarely damage the back of the eye. So I'm going to come back in a little bit and do an eye test on you before we start. And if you notice any change in your colour vision or your eyesight, you must let us know immediately and we'd have to stop that drug. As long as we look out for it, it shouldn't be a problem.
So I'd need to let you know if I've got problems with the eyesight.
Absolutely, and I'm going to test your eyes beforehand.
Okay, yeah.
Some of the other drugs, and it's not just one of them, but several of them, can cause side effects on the liver, where they can cause inflammation in the liver.
Well,
now obviously alcohol is not a very good thing for the liver
probably
either.
not. No, it's probably not good now already, is it? I mean, my liver. I mean, let's face it. I suspect. Well, probably not brilliant, is it?
We need to monitor your liver very carefully during treatment, which means regular blood tests. And I'll come back to the alcohol in a minute.
So
I think that's going to be an issue, but we'll come back to that. And occasionally, the other thing that I warn people about is that these medications can give people a rash. And again, that's very important that we know should you develop a rash, because it may mean we have to stop one or some of the drugs and try different combinations.
Oh, this is complicated, isn't it? It's. I mean. So I mean, this is not going to mess up my leaving hospital, is it? Because one of the nurses said something, and I'm not stopping any longer because, you know.
So this is the other part of treatment.
Yeah.
And TB, although it's very treatable, is also infectious, and because it takes such a long time to treat. In the first few months we treat people, there is potential that it can spread.
Yeah.
Now normally we are more than happy to treat people at home for TB, but if you're living with other people who are potentially exposed to your coughing.
Yeah, well, yes, I've nowhere to there's a place of my own or anything.
There's a risk that you could infect your colleagues, your contemporaries at the Salvation Army or wherever you're staying, if you're staying at a friend's house.
Yeah.
And there'd be a risk to them that you could give them the TB.
So I mean, what we're going to do about that? I mean, I must have caught it off somebody, mustn't I suppose? And
yeah.
You know, I mean, it's this cough, isn't it? That's a TB thing, isn't it? I mean, I just thought it was the bronchitis, but
you can catch TB from other people. You can also get TB in your childhood, and it can reactivate later in life. We need to go and have a look round your friends, and I'm going to be in touch with the public health department. Someone will come and meet you, and they will get a list of names of people you've been in touch with.
I'm not sure who some of them are, quite honestly. I mean, not really sure some of their names.
That's something that the public health people will do, and they'll have a chat to you, and they'll get as many names as they can, and they can pop down to the Salvation Army and screen for anyone else who may have got symptoms or signs. But from your point of view,
I've got to keep away from people. Then you're saying, really? I mean,
until we've got your sputum, your spit that's coming out clear of the bug, and I don't know how long that'll take. Could be a few weeks.
Yeah.
And in that time, I think because you've got nowhere to stay, I know you're not going to like me for saying this, but I think probably in here is the best place.
Here? No way, no, doctor, no.
Well,
I mean, it's all these old men. It's a geriatric ward. I'm not that old. I'm not stopping here and stuck in this little room by myself, and I'm not stopping here. I mean, I want to get back out there.
This is actually the admissions unit.
Surely fresh air's a good thing. Should be outside. I mean, there's, I don't want to stop here any longer.
It wouldn't necessarily be this ward. When I say here, I meant the hospital.
I'm certainly not stopping. Well, I'm not stopping on this ward. If you can find me something better.
What I would propose is that we move you to a side ward on the respiratory unit. That's where there's other people with lung conditions.
What were these old men around though?
Unfortunately, the nature of a hospital is that a lot of the people in here are older, just because.
But I mean, this lot, you've seen them, honestly, really. 18, I don't know what some of the ages, you know. I'm the youngster on the ward.
I'm afraid I wish I could say you're going to go onto a ward with a bunch of people in their 20s and 30s, but
Well, I don't,
unfortunately,
not to that extreme. And somebody more my own age, you know. I mean, for goodness sake.
The respiratory ward.
Well, at least it's better than here. Then I suppose it'd be better than here.
It's the best place, and they've got the facilities for, and you'll have your own room. Although we will be keen for you to stay in your room while we've got you we've got you on the treatment until your sputum, until your spit becomes clear of the bug.
Yeah.
You can, of course, we can get you out the room, but when you're in the hospital, we'll have you wearing a mask to protect the other people.
Great.
Obviously, if you're outside and you're in the open air, you can go for a walk and you don't need to wear the mask.
But I can go out
on your own.
I can go out.
You can go out.
Well, that's not too bad.
But you need to be. It's not going off to public places. It's if you want to go out for a cigarette or whatever, that's fine.
Still have cigarettes.
But not off down to the supermarket, because that's potentially where you could spread the bug.
Well, I mean, are you saying I can't have a drink or so? Because I mean,
okay,
you know,
that's a separate issue.
You know, that's been awfully difficult. I know they're giving me these tablets and things, but you know, it's not easy. It's not easy.
Have you ever thought about trying to cut down the alcohol in the past?
Well, what else is there? You know, I mean, since since I lost my home and you know, the family and everything, it's really all there is, really. What else is there for somebody like me? I mean, you know, it's easy for you to sit there, you know, as a doctor with all your salary and everything, in your house and your family and all of this. It's all right for you, but I mean, there's really nothing else. What else am I going to do? It does help. It does help. You know, yeah, I know you get used to it. You know, and I know this is some of my problems, but I mean...
Okay. The alcohol is an issue. And I
You know, I mean, it's here 6 days. It's been hard 6 days, you know, and you know...
With regards to drinking, I think while you're on the drugs for the TB, because I think if we don't treat the TB, you're going to get very sick, and that's going to be very unpleasant. I think you'll feel very ill. And I think if you continue drinking like this while you take the TB medication, there's a chance you could get into serious trouble, potentially develop liver failure.
Yeah, but it's one or the other, isn't it, really?
Well,
it's just one or the other, surely.
Not necessarily, because I think we can cure you of the TB. It's a curable disease, so we can make you feel a lot better.
Yeah.
We can also help with the alcohol. Now, this isn't something I can fix here and now, and you quite rightly say, you know, it's very easy for me to sit here and give you medical advice, but how about if I asked someone from we've got an alcohol counselling team in the hospital. It's not asking you to change, just to meet them. Would you be happy to have a chat to someone about it?
Well, I suppose if I'm stuck here, then at least I'm on another ward. I'm not stuck, definitely staying here. You know, I mean, all right, but I mean, I don't quite see the point because, like I say, you know, what is it? I mean, you're all right. You get me cured of TB, so be it. And then I go out, so fine. You know, I mean,
We've got a starting point. We're going to get you onto the treatment for TB. I'm going to do these eye tests.
Yeah.
We're going to get you onto all these tablets, and we will talk again. And I'll ask the alcohol counselling team to meet you, and I'll have a chat with social services about accommodation, and let's take it one day at a time. Okay? So we can revisit this again and
I suppose
talk some more.
Well, as I say, so if you can move it to another ward and. Like I say, if I can go out to have a cigarette or so.
I'll sort the ward out as soon as possible.
And I suppose at least it's, you know, I mean, at least I suppose it's regular meals and a roof over my head, isn't it?
Okay.
But, well, if you want to give it a try, I suppose I should try.
Let's give it a go.
Yeah. Still don't quite see the point, but anyhow, no, if you... Yeah.
Okay. Give me some time on this one and we'll...
All right.
See what we can do.
Okay.
Okay. All right. Okay.
Cheers, Doctor.
Thank you. So this is the discussion relating to Mr. Wurzel, a gentleman who is an alcoholic in hospital with tuberculosis, who is very reluctant to stay as an inpatient for his treatment, although he is clearly high risk for spreading the disease, as he has no fixed abode and is living in a Salvation Army from time to time. This highlights a sort of a challenging situation of what do you do if a patient needs to be detained in hospital. The most obvious approach is to explain to the individual why it's so important they have their treatment and what the risks are. In this case, Mr. Wurzel realised that he was potentially a hazard to his friends, and so it was in their interest as well as his to remain for treatment. Potentially in the questions afterwards, though, you could be asked what is the legal position should he still refuse, and there is actually a remit under law, the Public Health Act of 1984, which actually can be used to detain someone in hospital because they are a risk from an infectious disease point of view. This is not obviously something that you wouldn't do as a junior doctor, but would be getting your consultant involved in it and getting sort of official advice about. The majority of the patients with TB, however, you must remember that the nice recommendations is actually people with TB should be managed as an outpatient. Certainly, if someone lived on their own, it would be far better to manage them as an outpatient, because in hospital they're at risk to other patients. Obviously, would need to be in ideally a negative pressure room with full sort of respiratory precautions taken by the staff that are regularly visiting them. The other issue that was sort of raised here was what about discussing the drugs and the potential for side effects. Explaining medication is a common thing for the exam, and so it's important, for example, in this case, awareness of ethambutol potentially causing retinal toxicity and the need to check colour vision using Ishihara charts beforehand. But equally, it would be reasonable to be asked to explain treatment with methotrexate for a patient with rheumatoid arthritis, or potentially treatment side effects of treatments for hypertension, for example, the risks of complications of a beta blocker or amlodipine. The other final thing about this was it was complicated by the fact this gentleman was an alcoholic, and in this setting this is going to be an issue because of the risk of liver toxicity from the TB medications and his alcohol consumption. It's important when you're discussing things like this to draw on your support from other teams, the alcohol liaison service, and also going back to sort of the basic, explaining to the patient why you recommend against the alcohol consumption in the sort of context of the medication he's being prescribed.